Good morning, all. Doug Schomer with Visiting Angels, back with another one of our sessions to talk about one of our speakers that's going to be presenting at 125 Live next week. We have Emily Kirkwald with us, and Emily is a pharmacist, and she's going to be giving us a presentation next week that I think will be of interest to everybody. Good morning, Emily. Thank you for taking time to do this.
Good morning. Thank you so much for having me.
You bet. Glad to have you. I appreciate this. Tell us a little bit about yourself.
Yeah, hello. I am Dr. Emily Kirkwald. I am the natural family planning pharmacist. So I have a doctorate in pharmacy and I own my own business called NFP Pharmacist, where I meet with patients for individual appointments to help them achieve their health goals. So, one branch of my business is helping women with family planning, but the other branch of my business is to help any patient really understand their medications. My goal for every patient is that you would know everything you are taking is needed, safe, and effective. And I'm a pharmacist who works for you, the patient. I don't work for a doctor's office or a pharmacy. I really work to help you understand your medications so you can be an advocate for your own health. And I've been a pharmacist since 2013. I have also been married to my husband, Ben, since 2013. And we have two children, Henry, who is 5, and Amelia, who is 3. And we live in the Twin Cities.
Oh, that's great. That's great. So, yeah, it sounds like between work and those two little ones, that's got to keep you pretty busy.
Definitely, definitely.
Yeah, that's all right. So, Henry and what's the second child?
And my daughter, Amelia.
Amelia. Okay. So, yeah, so a boy and a girl. That's very cool. All right.
Yeah. And they're at really great ages right now, 5 and 3, where they're really great at playing with each other.
Well, I asked Emily if she would come and speak for us at this presentation coming up in next Monday. I think this is something that I know for myself and for other seniors that I talk to. This is something that can get confusing a little bit. Uh, as we age, we find ourselves taking more medications than what we might have, and I don't know that we always have an opportunity to really have a good understanding why here's another bottle of pills, here's another bottle of pills. What's going on with that. And there's always been some concern on my part about how do they interact with each other too. So I think this is really timely. Tell us a little bit about what you're going to present on Monday.
Yes. I'm really excited to talk about the importance of knowing your medications. So, we'll talk about why it is important to know all the medications you are taking, not just relying on your doctor to keep a list of your medications, but to be sure you have an up to date list of your medications and know them. We will talk about how a pharmacist can be a beneficial resource for you in addition to your doctor or other healthcare professional you may see, and how a pharmacist works together with your healthcare team. We will discuss how do you talk to your doctor if you have a concern about a medication you are taking? What are the right questions to ask? And we'll talk about when your provider wants to start you on a new medication. What are some questions you can ask to ensure you're really understanding and you know that the new medication is needed for you and is safe for you with the other medications or supplements you may be taking? And then lastly, we'll discuss why reviewing all of your medications and supplements, vitamins that you're taking at least once a year is essential for your health.
See, I was going to ask that question. I'm glad you mentioned that. You said it at least once a year because,
Mhm.
I think maybe, I don't know, but maybe when medications change, that might be also a good time to uh, to reach out and talk to a pharmacist. I know that I doctor here in Rochester with the Mayo Clinic. We got a uh, primary doc that I see that's what do they call it? General practitioner or family health, I guess is what
Mhm.
they refer to him as. Great guy, I really enjoy him, but he would be the first to admit that he can't know everything about everything.
Mhm.
So if somebody and you mentioned you're in the Twin Cities, but if somebody that's going to be watching this and attending the seminar and maybe is from Olmsted County, the Rochester area down here, uh, they can still have a meeting with you, maybe just like this with Zoom, right?
Exactly, exactly. I am licensed in the state of Minnesota and I can work with all of my patients virtually. So, exactly like this, we can meet over a virtual visit. And as long as you have a list of your medications, we can review and talk about all of them.
Okay. And I think that's important. This past year, of course, has changed for a lot of us. We used to do all these presentations live, uh, with our audience right there. But with everything that's happened over the past year, we're doing them by Zoom. And I even found myself having a couple of doctor appointments by Zoom
Mhm.
with my family med guy. So I would think it would be good to be able to do that. Is there anything else that you want to talk about or bring up before we cut this off about this upcoming presentation?
Yeah, just one other thing I was going to mention is that if you are on a Medicare drug plan, most of those plans do cover a once a year medication review visit. And so, once a year, Medicare will pay for you to have a visit with your doctor, or more and more doctors, clinics now are hiring pharmacists to work in the clinic too, to review your medications, and make sure that everything is up to date and that you understand your medication. So make sure you know, if that's a service that your doctor's office provides too. And that's something we'll talk about, one of the questions that you should ask your provider when you have your visit.
Okay, so you do accept some insurances.
I actually don't. I only take cash payment, non-insurance payment, but so I always advocate for people, if they do have insurance and this service is covered for them, to make sure that they're inquiring about that as well.
Okay, great. Um, for those that are watching this, if they want to get a hold of you, what's the best way to get in touch with you?
Yeah, the best way is through my website, which is nfppharmacist.com, or by sending me an email to emily@nfppharmacist.com.
Okay, great. And if you didn't have a chance to write that down, you just get a hold of Visiting Angels, ask for Doug, and I can get you Emily's information. Emily, we're looking forward to your presentation this coming Monday. Thank you for taking time for this interview this morning, and you have a wonderful and blessed Easter. And folks, hope to see you on Zoom on Monday. Bye.
Bye.